Hi, everyone. I am Carrie Lim, a speech language pathologist in the United States, and I am very excited to interview someone from Ghana, and I will let her introduce herself.
Hi, everyone. My name is Josephine Ohenewa Bampoe, and I'm a speech and language therapist in Ghana. I work with the University of Ghana, where we have a new program. Well, we've had it for some years now, since 2016. So, in an MSc program in speech and language therapy.
Great. And so in Ghana, the profession is termed speech language therapist. Is that correct?
Therapist, absolutely.
Great. Yeah, I know it varies from country to country. In the US, we're speech language pathologists. So I always like to ask what the title is. And so for short, is that SLT?
Absolutely. So we do refer to ourselves as SLTs, yeah.
Okay.
And it's fine.
And then what are the educational requirements for SLTs in Ghana?
Okay, so there are two programs currently running in Ghana. That's a bachelor's and a master's program. And so basically that's it really. So that's a bachelor's and a postgraduate program in speech and language therapy. And they both will graduate as speech and language therapists, really.
Okay. In Ghana, can you work with just your bachelor's or is the master's required?
Yeah, no. So you can work with your bachelor's as it is now. And so it's like an entry level master's really. And we often will take for the postgraduate program, we usually look out for people who have bachelor's in linguistics, psychology, education, nursing, or other allied health specialty areas. If you have any relevant experience, that may be an added advantage, really. But yes, the bachelor's program graduate speech and language therapists who can equally assess, treat persons with communication and swallowing disorders.
Okay. And so what would be the incentive then for someone to go on and get their master's?
Well, I guess it's about passion.
Okay.
Really. Yeah. So if you have heard about the profession or know about the profession or have had some experience with knowing about the profession or volunteered and would want to work with persons with communication and swallowing disorders, then you may want to, but as it is now, really, that's an interesting question, I guess. But the passion for me drives the whole thing to want to do it at the master's level.
Okay. Yeah, I wasn't sure if if you wanted to teach, then you needed to go on to get your master's, like if you wanted to train.
Yeah, absolutely. Well, yeah. Well, if you want to go into education, possibly that would be one of the incentives as well. I mean, if that's your focus and you don't really want to go into like clinical practice, or maybe do the two, then it would be one of the things that you may want to do. But of course, obviously doing the master's is not enough. Then that means you need to be thinking about PhDs as well.
Okay, very interesting. Yeah, I think that's great. And so one of the things that's required in the US, speech pathologists have to do training every so often. It varies by the state that they're in. And then of course we have ASHA, the American Speech Language and Hearing Association, that has its own requirements. Are there also ongoing training requirements in Ghana once people have graduated?
Yeah, absolutely. So once you graduate, you have to do a 1-year internship. It is mandatory to be licensed as a speech and language therapist in Ghana. In addition to your 1-year internship, which you need to pass, you also need to write a licensure exam. And to be licensed. So you need these two to be licensed. And once you're licensed, you need to, every year, there are a number of CPD points that you're supposed to have to renew your PIN, we call it. So, and this is done by the Allied Health Professions Council that regulates all allied health professions in Ghana.
Okay.
And we have, similar to what you have in the US as ASHA, we have the Speech Therapist and Audiologists Association of Ghana, we call it STAG, which is our association, or the association for the profession is for both speech pathologists and audiologists. And usually the association organizes these CPDs for members to attend. And it has to be relevant to the field. So it has to be relevant to both audiology and speech pathology. Sorry, I'm using speech pathology sometimes, but it's the same thing. Speech pathology, speech therapy.
Yes, I go back.
Yeah, it's fine. It's confusing sometimes.
Yeah. Yeah. Sometimes people ask what the difference is, and I say it depends on who I'm talking to, but it's really the same.
Absolutely.
Yeah. And that definitely sounds. Oh, sorry, go ahead.
Yeah. No, so I was just saying that so that's what we do. But speech pathology or speech therapy is a developing profession in Ghana. So we're still developing. Everything is probably in its infancy, I would say.
Yeah, but you're doing amazing work. It does sound very similar to ASHA standards and what we practice in the US. And so how many programs are in Ghana for the bachelor's?
There's one.
One, okay. And is that the one?
As in one university, yeah. Sorry.
Okay. Is that the one that you helped to start?
No, ours is the master's.
Oh, okay, gotcha.
Yeah.
So one bachelor's, and then is there just the one master's program?
Yes, so one bachelor's, one master's, yeah. As far as I'm concerned, unless there's something, another program somewhere that I'm not quite sure of, but yeah.
Oh, wow.
And even if there is, that will also be either a master's or a bachelor's anyway.
Okay. And then was that at the University of Ghana?
Yeah, that's the master's. So the University of Ghana has the master's, and the University of Allied Health Sciences in the Volta region of Ghana has the bachelor's degree.
Oh, wow. Okay. Off the top of your head, do you know how many people live in Ghana, roughly?
I think we are roughly about 32 million Ghanaian people.
Okay. Wow. Yeah, that's a lot of people.
It is. And the number of speech pathologists we have will probably be around maybe, let's say 50 or less than 50.
Oh, wow. I'm sure they're very busy.
Yeah, extremely, woefully inadequate. And most of them are in the capital. So Ghana has 16 regions. Okay. And the capital is just one of the many, one of the 16. So, and a few of the others have maybe one or two.
Yeah.
Yeah.
Oh, wow. So yeah, some of my other questions for you, what are the settings that speech therapists are employed in?
So all over really, we have speech therapists in the health sector, so those in hospitals and private clinics. There are also those in schools, not many in schools really, because again, our difficulty at the moment is the fact that government is not yet employing speech therapists. And so quite a number of them are in private practice. A few of the government institutions that are quite autonomous have been able to absorb some of the speech therapists who are providing services for Ghanaians. And then we have some of them, like me, in the universities where we're teaching.
Okay, wow.
And training speech therapists, yeah.
Yeah. I know I can't imagine how hard it is to be in private practice. I know in the US, a lot of SLPs work in schools. I think that's the primary employer. And then a lot in healthcare as well. Again, many in private practice as well, but I feel like that's a very challenging area to be in. So,
yeah.
So since a lot of the speech therapists are in private practice, then how are the services funded by the families?
That's an interesting question. So at the moment, families pay for services from their pocket. Most families really. A few families who have private insurance may be fortunate to get SLT costs covered. But the National Health Insurance Scheme, which is from the government, doesn't yet cover SLT services. So people are having to pay mostly from their pocket to get services, yeah.
Off the top of your head, do you know roughly what one session would cost?
Well, it also depends on whether you are seeking services from like a private clinic or or a speech therapist who is in private practice, or you are seeking services from a government or public institution. That's the few public or government institutions that have the service. And so for private clinics, you probably will be paying for, it also depends on the kind of service. So in private practice, you probably may be paying close to about $32 for initial assessments.
Okay.
If it's therapy, it's about $16. And sometimes there's a package. So if, for instance, you have done the initial assessments and you decide that this child you're going to do like a block of 18 sessions to begin with, or there's some sort of a package for that, and which is a little bit reduced, so that the therapy session will probably be like $14 per session, compared to the $16, when it's not as regular or it's not part of a package that has been offered to you. And then if it's a review assessment, then you probably would have to pay about $20 for that. In the government or the public institutions, if it's an initial assessment for a child pediatric case, then you probably will be paying around about $12.
Oh, wow.
If it's pediatric, if it's a child and it's review therapy, it's about $8. If it's adults, initial assessment, it's about $15.
Oh, wow. Okay. And then what currency?
Per session. So everything's per session. Our currency is the Ghanaian, we call it cedis. Ghanaian cedis. So,
okay.
Or the cedi. Yeah. So I've done the conversion for you in dollars so that you can appreciate how much.
Oh, okay. Thank you. So that would be about $15 US for the government.
Yeah. So everything that I said, amount I quoted was in dollars for you.
Thank you very much.
It's not in Ghana cedis. I did say, I think you must have missed it.
Oh, sorry about that. Yeah, thank you.
Yeah.
That was
No, but I wouldn't put you on the spot like that.
I know. I felt like I put you on the spot, so I appreciate you doing your homework.
No. Yeah.
So where do a lot of the referrals come from? Do you find that a lot of families know about speech therapy, or because it's really limited to the capital, are a lot of people still unaware?
Well, I think a lot of people are still unaware, really, but a lot of referrals are from medical or health workers, so healthcare workers. So pediatricians, neuropediatricians, general practitioners, ENTs, a lot from ENTs and audiologists, physician specialists and other specialists, really. But I think a lot of people are now unaware. I mean, there are even health care professionals who are still unaware, and continue to encourage families to maybe keep talking to their child or exposing them to language, but not necessarily referring them to speech therapists. There are families who are also aware, and some teachers who also know of the service and may talk to families about it if they are concerned about a child in their class or in their school.
Okay. And how would you say the families in Ghana view disabilities for pediatrics and for adults?
I think the general attitude and perceptions of Ghanaian families towards disability are often based on fear and misunderstandings. Yeah. And so there's that stereotype of individuals with disabilities, and often exposing them to prejudice, discrimination, stigma, and ultimately denying them of their rights and resources. And so, and because most Ghanaians are religious or spiritual, I would say, there are families who view it as coming as something spiritual, and may need some prayers or some sort of purification to cure the person, etc. Yeah, especially when it's physical disabilities, really. But like I said, a lot of it's around fear and not knowing what to do. But religion does play a big role also there. And so as a speech and language therapist in Ghana, it's important that as part of your practice, you need to acknowledge the fact that religion is maybe key to most of the clients that you see. And also not just acknowledging it, but also appreciating the fact that it probably would have to be part of the therapeutic process.
Mm-hmm. Yeah. Do a lot of families believe that a disability could be almost like a curse, like it was given by God?
Yeah. Sorry, go on.
Oh yeah. And then also, like you were saying, so also that's part of treatment. So maybe trying to pray for the healing or forgiveness. Okay. Gotcha.
So there are families who would believe that it is something from maybe the devil or a case, like you said, and so would need prayers for it to go. But there are families who are also religious and may believe that if they pray, God can heal whoever it is, whether a child or an adult or whatever. But there are families who would hold these views or these beliefs, but also seek services.
Right.
And there are families who would hold these views and may not necessarily seek services. There are those who also hold these views or may not necessarily hold these views, but also hoping that by seeing the speech and language therapist, there's going to be like some sort of magic pill to make their children talk or speak or whatever difficulty that they're having. And if it doesn't happen on the first visit, then it's like they are disappointed and may want to seek help elsewhere.
Yeah, I've definitely come across that with some of my families as well. They think one or two sessions and, they're going to start talking or, speaking in sentences. So, yeah.
And to be honest, it's really hard on families to have children or, adults who have difficulties with communication, because communication is quite key, really. And so often they are lost and don't know what to do and really looking for some sort of miracle. Hence that expectations, really.
Understandable. So what would you say are the barriers to families accessing services? So you said there's roughly 50 speech therapists and about 34 million people in Ghana.
32 million.
32 million. Yeah, so that's quite a lot. What are some of the other barriers? You also mentioned that most speech therapists are in the capital.
Yeah. So because the training at the University of Ghana is in the capital anyway, but also how attractive the capital of a country always is. And the fact that it probably has most services and most and well developed. Mm-hmm. And so everybody wants to work in the capital, really. But funding is, as mentioned earlier, is one of the biggest barriers, I would say. Most families have to pay for services from their pocket, and that can be so difficult, especially for families who can afford it. But also time, really, because it takes time. As you may be aware, for some of these conditions, for us to see some sort of progress in some of these conditions that we see, mostly in clinic. And therefore, if you're a working parent, taking time off work to always take your child to see the speech therapist can be difficult. And it can be some sort of barrier for some families, because if they are unable to get time off work, then it means they are not sending their child for the speech therapy services or to access services. There's also the issue of shortage of SLP, or I would say not shortage per se, but rather inadequate yeah, not enough, meaning I'm just basically trying to say that we don't have enough speech and language therapists. And I guess that's also a big barrier there for us. And so people have to travel sometimes to the capital or to the nearest hospital or private practice that they can access service. And that may mean money, because not just money to pay for services, but also money for transport to get to where the service is, to be able to be seen by the speech and language therapist. Also, as mentioned earlier, religion can sometimes be some sort of barrier, as some families may prefer to seek some sort of spiritual healing, and they may discontinue therapy because of that. And sometimes I have seen families who have done that and have been back after a period, and the child would have regressed. And so it's like you have to start all over again, and they may have certain behaviors that they've learned over the period, and that can be difficult, really. So, yeah.
Makes sense. So is there anything that volunteers could do if they wanted to get involved? What would that look like? What language would they need to speak or languages? And what would be the next steps?
Right. I'm happy you asked about the languages, because Ghana is highly, highly multilingual. And so, well, according to research, Ghana has close to about 81 languages. Some have said 41, some have said 80, 81. I think it's also the issue about dialects and languages, really. But indeed, we will welcome any support from any volunteer. It's important that anybody who volunteers is actually supported by a local person and made aware of the context, try to understand the culture of Ghanaians. But most importantly, the language is quite key. The official language of Ghanaians is English. But when you're working with families, yeah, you need to be thinking about how you would make it easier for them to understand what you are saying to them. And some of this may include maybe getting somebody who would even interpret what you are saying to the families, really. Yeah. I would say if you want to volunteer, it's important that you first contact. You can contact me. I'm happy to link you with the association or the university, depending on what kind of supports you want to give. If it's about teaching, if it's about providing services, if it's about whatever it is, I'm happy to kind of find out and let you know what the requirements are to be able to support SLT. But we are always happy to have somebody support us. We've done a lot of partnership, even for our program at the University of Ghana. We've had a lot of partnership with people, SLTs from all over, from the UK, from Australia, from the US, from Sweden, all over.
Great. So what is the best way for people to get in contact with you?
They can send me an email. My email is jobamp@hotmail.com. Then I'm happy to support, let you know what you are required to do to be able to support the program. But we can do that through the association. That's the Speech Therapist and Audiologists Association of Ghana, or the universities. Sorry.
Okay, perfect. I'll certainly put that in the notes as well. Is there anything else that you want to talk more about? Anything I forgot?
Well, I think as I mentioned earlier, speech pathology is a developing profession in Ghana. So we are happy to have people come support us, even if it's in training and you cannot even come there in person. But you have a specialty area that is of interest to you and you think you can share something you've discovered. I think people are maybe also happy to engage with researchers who may be interested in supporting people to do some sort of research in Ghana, because I think one of the areas that we are also lacking is the area of research, because we haven't done research in the context to kind of also know how differently children in Ghana develop in terms of their communication. So like having even just communication milestones for Ghanaian children, because obviously most Ghanaian children are multilingual, and so their language development or trajectory may not necessarily be the same as a monolingual child in the US, for instance. And so having some of these evidence-based things to be able to fall on when we are practicing or working with parents will be extremely helpful. Because as it is now, we are now trying to develop resources that are culturally appropriate for our context. They will appreciate any help we get.
Okay. Gotcha. That makes a lot of sense. Okay.
And I also want to use this opportunity to say a very big thank you to you for the support. You've supported us in our teaching at the University of Ghana, and I say that was really helpful. So thank you so much, Carrie.
Oh, you're very welcome.
For the support.
Thank you. Yeah, it's been great to see you grow. I mean, you guys have just taken off and you've done so much, and I'm so, so proud of you guys. And I'm glad I could just help a little bit, but you've done so much work for your program, and you just continue to shine.
Thank you.
So you're going to do great things. You're in Australia now. I don't know if you want to share on the recording, but you're currently working on your doctorate now.
Yes, I am.
Which is very
and I'm looking at developing an assessment tool that we can use to assess Ghanaian children who speak in English. And so it fits into that, what I said about you saying culturally appropriate resources to provide services in Ghana.
Yeah, that's amazing. Keep up the great work.
Thank you.
Well, great. Well, thank you so much for your time.
Thanks so much for having me.